Hello. So we've been learning about pyogenic liver abscess and amoebic liver abscess and the difference between these two since we were kids, right? Since second year we know this. But there is one very important part of pathophysiology that I had missed that gives a completely new insight to how I was learning this topic. Okay. So in this table randomly you will just see that in pyogenic liver abscess ALP is increasing, but in amoebic liver abscess PTINR is increasing. So I was like, why is this happening? Like, what is the logic? How am I supposed to just rote learn this? Right, I'll remember it for 2 days, but what about after that? There has to be some intuitiveness in facts also, right? So there has to be some logic why this happens. So I studied and I realized that it's all in the pathology of it. So basically, what happens is, what is ALP? ALP is present in the cells of the bile ducts. So when they are damaged, you will have increased ALP. Okay, remember that for life. That logic is true for anything. Then PTINR. PTINR rises when there is an issue in the clotting factors, right? So remember that for life, clotting factors are synthesized by the hepatocytes. So if there's any issue in the hepatocytes, your PTINR will increase. Okay. Now let's understand the mechanism of how we acquire these two infections. So pyogenic liver abscess is acquired by ascending cholangitis. So you have your duodenum, imagine. From the duodenum, there is this infection. Most commonly it occurs by E. coli, right? So E. coli will travel along the common bile duct and then into the small bile canaliculi. That is how you get pyogenic liver abscess. So that is why there is mechanism is cholestasis. That is why ALP is the first to rise. Okay, so the first issue that happens is obstruction, cholestasis, and that is why your ALP will rise. But in amoebic liver abscess, the amoeba will reach the liver via blood. So via the portal circulation, it will reach the hepatocytes first, which is why there will be dysregulation in the synthesis of the clotting factors, which is why PTINR will increase first. Okay, so you understand this, that in pyogenic liver abscess there is a problem in the bile. The hepatocytes in the early stages are fairly conserved, so the function of the hepatocytes is conserved. And in amoebic liver abscess, the hepatocytes will get necrosed first. Okay, the bile synthesis and all is happening normally. This is also, like, when I thought about it, that was also the reason why pyogenic liver abscess will get jaundice earlier, because it's having a problem in the bile synthesis, right? There's obstruction, cholestasis, jaundice. But amoebic liver abscess will have jaundice as a fairly late symptom. Okay, so that is how, like, after studying in this manner, I'm gonna remember it for life because I know the intuitive logic behind all of these just random facts that they've given. Okay, very important, like, very cute thing that I liked was pyogenic liver abscess, pipes is blocked, so ALP rises. Amoebic abscess, the factory is destroyed, right? The hepatocyte is destroyed, which is why PTINR rises. Okay, hope you like this little snippet. Thank you.